Hi, my name's Rebecca. I'm a level one nursing student. I was just wondering if I could follow you today. Is that okay?
Sure, absolutely.
I was just wondering if you could give me a SBAR report on the patient, please.
Sure. Today we have a 67-year-old male. He's in room 621. It's Greg Lutz. He has no known allergies. He's a full code. His doctor is going to be Dr. Kay Phillips. He is on an 1,800 calorie diet with a 2-gram sodium restriction. He was admitted today with a non-healing wound to his right heel times 3 weeks and high blood glucose levels times 5 days. His pupils are equal, round, and reactive to light. He does wear glasses. He is steady gait, and he has some tingling in his lower legs. It's been going on for about 3 months. He has clear lung sounds. They're unlabored. He has a regular rate and rhythm, S1 and S2 heart sounds, with no rub, murmur, or gallop. His abdomen is flat and non-tender, and he has bowel sounds in all 4 quadrants. And he seems to be voiding okay. We didn't have to do any assessing there. His vital signs are all within normal limits at 98.4, 80 heart rate, and 96% saturation, and 128/70. His recent meds were simvastatin and gabapentin, and he did take some morphine for pain. His last AccuCheck was 242, and he does have an IV in the right forearm. And let's see what else. He has some labs pending, but his most recent labs were all within normal limits at this time, so we're waiting for the new labs to come up.
Okay, thank you for all that info. Why specifically is this client receiving this medication?
This patient is a type 1 diabetic, so we're going to be giving him his NPH insulin, and it is
What action does the medication have on the body?
it is used to regulate the use of fats, proteins, and carbs in your body.
Okay, when should you question administering this medication?
You should question when the patient has low blood sugar.
Okay, does this medication have a therapeutic serum level?
Yes. The onset is about 1.5 hours, with the greatest glucose lowering between 4 and 6 hours, but you may have effects up to 24 hours.
Oh, okay. Which vital signs must be monitored?
I would check your blood glucose levels and keep an eye on the patient's heart rate and blood pressure.
Okay. Which physiological parameters should be monitored when the medication is being administered?
That would be your blood glucose levels and also your glucose level via a lab draw.
All right. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
The client should, as a nurse, we should be checking their blood glucose levels before giving this medication, making sure that the patient has ordered a food tray or has food on the way. And they should also, we should also teach them about their signs and symptoms from hypoglycemia and hyperglycemia.
Oh. What interventions must be taught for taking the medication safely at home?
The patient should know how to use their glucose monitor the correct way and make sure that they have all of the correct equipment for that. We should also tell them that they should have a snack at all times with them in their purse or at their bedside at night for low blood sugar. And they should know the signs and symptoms of hypoglycemia, which can be shakiness, anxiety, fast heart rate, and sweating.
What are the side effects and potential adverse reactions?
The side effects of this medication are, of course, hypoglycemia is the most common, but there also are lower potassium levels, and so we definitely want to be monitoring their heart rate and their CBC and BNP, and also lower leg edema.
Okay. How will you know the medication is effective?
If the blood glucose remains stable level while you're giving your medication.
Okay.
Alrighty. I'm going to go ahead insulin.
Awesome.
Hello, Mr. Lutz. How are you doing today?
I'm doing okay.
Melissa, and this is Rebecca. Your student.
Hello.
We're going to give your insulin.
So we do that information about the insulin cell reactions, some information about proper diet.
So, can you tell me your name and birthday?
And requested more information.
Mr. Birth year.
So I'm going to perform some safety checks.
Mr.
Medication.
Lutz.
Medication to be administered.
Very embarrassed.
Correct syringe.
Maybe you should check the front desk.
The route is going to be subcutaneous. And 6 minutes.
Oh,
Time.
I threw it around. I'm sorry. I don't like my wristband.
So, Mr. Lutz, how old are you?
I'm 67 years old.
Alright. So I'm here to give you your MPH insulin.
Go ahead and scan your bracelet.
This is your long-acting insulin. Okay. You've taken this before, right?
Yeah, I take this at home.
Alright.
Verified, so it is correct. I'll be administering it to your abdomen, your left abdomen.
Let's try this one more time. That happens a lot, unfortunately. Okay, we got Greg Lutz.
Okay. Okay, no. That's why we have to put a little insulin for
Any
you.
family coming to visit you today?
No.
I'll keep it with me then.
There we go.
You have
Find out.
any symptomatology, for example, any headache, or do you feel okay, or do you feel okay? And
Mismatch.
Inserting 6 units of air.
we have to check.
Alrighty.
Your name and your age. Okay, thank you.
And that injection site looks good.
Really felt it. Okay, here we go. 1, 2, 3. Alrighty. Put away my gloves here.
Is there anything else I can get for you?
Trash can.
We'll lower your bed again. You have your call light?
Yep. Is there anything else I can do for you at this time?
I think I'm okay.
Okay, you have your call light if you need anything at all, and I will be back shortly to check on you.
Alrighty.
Thanks for letting me watch.
Of course.
Alrighty. Do you have any questions?
I do actually, thank you. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I did check the patient's blood glucose level, which was 245 at the time, and I also checked their glucose level via their CBC.
Okay. Did this information affect your decision to administer the medication?
It showed me if I should administer the medication, which was yes.
Okay. So did this information affect how you administered the medication?
No, the medication is administered sub-Q, which is what the doctor had ordered, so we were all set there.
All right. Thank you very much.
Thank you.